Hi everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics. I wanted to show a recent great success story of early phase 1 treatment. This is Emily. Emily came to us because she has an underbite, and you can see the underbite just visibly here when she smiles. That means her upper front teeth are behind her lower front teeth. And why do we want to treat underbites early? Well, Emily, by the way, is about 8 years old, and we like to treat underbites early because at this age, at age 8, 9, 10, the upper jaw is growing more than the lower jaw. So the upper jaw is actually outpacing the growth of the lower jaw. When folks hit puberty, that's earlier for girls than it is for boys, but then the lower jaw growth outpaces the upper jaw growth. And so if you have an underbite situation early at 8, 9, and 10 years old, when you get that later mandibular growth with puberty, it's very possible that whatever underbite you have to start with gets worse. Sometimes that underbite gets so bad that you cannot treat it orthodontically, that it actually requires surgical correction with a controlled fracture of the jaw. And so, of course, a controlled fracture, a breaking of the jaw is not something that anybody wants. If we can avoid jaw surgery, we do it. And so early treatment can help rectify these situations. If you can help the growth of the upper jaw, you can normalize the growth pattern and then try to avoid that underbite showing up later and avoid things like jaw surgery. So that's why we like to treat these really early. There are some other reasons as well, and that's, for example, kids like this tend to hit too hard on their front teeth, so a lot of times you'll see damaged and worn front teeth. Sometimes you can even see gum recession on some of the lower teeth because of the way that those teeth are coming together. And I think it also impacts self-esteem, and so you'll see a nice aesthetic change here from Emily. All right, this is a close-up of Emily's front teeth, and you can appreciate the underbite, how those upper front teeth are behind the lower front teeth. And in truth, the underbite actually is not this bad. But this is how Emily bites down when she wants to bite down on her back teeth. She's unable to bite down on her back teeth any other way than this. And the reason is because her normal bite, the way her jaws would like her to bite together, actually is what we call edge to edge, where the upper front teeth would hit right on top of the lower front teeth. But that's a very uncomfortable way to bite. The body does not like it, and the body will do things to try to avoid hitting edge to edge. The reason why the body doesn't like edge-to-edge bites is because it damages the teeth. It's too much trauma on the teeth. It can actually cause people to have chronic headaches over time. And so to try to bring their back teeth together, what they do is they shift their lower jaw forward a little bit, and that's the only way that they can bring the back teeth together. So this underbite actually looks a little bit worse in this picture than it truly is, but the point is still the same. This is how we typically treat underbites. There are lots of ways to treat underbites, and really every situation is unique, but one major strategy that we have is by using a reverse pull headgear. So this is the only type of headgear that we use in the office. This is also called a face mask, and the whole idea here is that we're using the forehead and the chin as stabilization points to pull the upper jaw forward. So if you look at this picture, the rubber bands are attaching to an appliance that's connected to the upper jaw. This particular girl has braces on all the upper front teeth. In Emily's mouth, we did not use any braces. All we used was a palate expander, which was not even really used for palate expansion. It was really just used to connect to this reverse pull headgear. And then the rubber bands are used to pull the upper jaw forward. So this is not really moving teeth so much as it is moving the jaw bone. So this is an orthopedic change. It's actually altering the position of the upper jaw bone and trying to rectify that growth so that the upper jaw growth can then resume and the lower jaw growth will come back later in puberty. So here are the results that we got from Emily. Emily wore this reverse pull headgear for 6 months. She was a fantastic patient, very diligent about wearing it. We ask to wear this about 12 hours each day, and we do not ask kids to wear it to school. We don't ask them to wear it to any activities. We don't ask them even to wear it to sleepovers. We're asking for 12 hours, which is usually kind of from the end of dinner till breakfast time. And so that's how we coach people to do it. If you're having a sleepover, don't wear it. If any of your friends might see you wearing this, don't take it. We just want you to wear this in the privacy of your own home as close to 12 hours a day as possible, and typically, again, from the end of dinner to breakfast time. And Emily did that. She was a fantastic patient. Check out these results. So here's the bite. We did, again, no braces were involved in this treatment, nothing other than that reverse pull headgear. and the palate expander was just used to hook up to the reverse pull headgear. So we got some very positive changes. You can see the upper teeth are in front of the lower front teeth. We actually have a little bit of extra overbite, which is great because we're going to account for lower jaw growth that's going to happen later as she hits puberty. And here's her smile, which is a really, really nice change in the smile just from the reverse pull headgear. So some amazing changes that you got there, Emily. And then I'd love to show you this side by side. So this may not look dramatic, but this is the change in profile that occurs when you bring that upper jaw forward. If you look at the picture to the left where she started, the upper lip is behind the lower lip. And a lot of people wouldn't notice that if you were just looking at that in and of itself. But it's a much more aesthetic change because as the upper jaw comes forward, the upper lip comes forward, and then you get this really harmonious profile. So from the side, this definitely looks a lot better, and it's a great change. And then, of course, here's that difference in Emily's smile, which is a huge change from using that reverse pull headgear. So anyway, great job, Emily. I hope this is instructive for folks, because I think when people see that headgear, that reverse pull face mask, they get a little freaked out, but it's pretty easy to wear. It doesn't inhibit sleeping because it goes just right on the front side of the face. And unless you sleep with your face straight down in the pillow, which you can't do, you can't breathe that way, then it really doesn't inhibit sleep. It's a pretty easy thing to wear. And Emily got some great results, and we can get great results with that face mask with good wear, just like what Emily demonstrated. And so you see some of the results just from that one appliance alone. I feel really confident here that we have set Emily's jaw growth up for a successful pattern now, a successful pattern of growth. Barring anything crazy, I don't see her underbite ever coming back, and we shouldn't even have to think about jaw surgery or anything crazy in the future. So congrats, Emily, on being amazing. And if you know somebody that has an underbite, send them our way. Would love to take care of them. It doesn't always involve a face mask, but it is a great way to make that orthopedic, that bony change, not just moving teeth. So thanks for listening. Hope you learned something today.